Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined by Dave Francis, the CEO at Healthpilot. How's it going, Dave?
Hey Jared, how are you?
I'm doing well. Excited to speak with you here today. Thanks for joining
Thanks for
me.
thanks for having us.
Absolutely. Let's dive right into it. We tend to keep these short and sweet. So I'd love to hear about your background and then we can talk more about Healthpilot.
Yeah, thanks. And again, we're excited to talk a little bit about our company. Excited about what we're doing. I am a recovering investment banker. I'm a finance geek by training. Was in the investment banking and equity research business for way too long until I finally went out and got a real job about 6 7 years ago, turning around a public company out in California called eHealth. And that was it was a great experience. The stock ended up going up about 10 12 times from where I got there to when I left. Um, but it was at that point where I was able to experience firsthand what I would call the horror show that is Medicare insurance from a senior customer's perspective in the marketplace. And we saw a massive opportunity to help a population in need and build a transformative business in the senior healthcare space, starting with Medicare insurance, and that's how we got going with Healthpilot.
And so that's how things started up. Can you talk us through? We've always focused in on three things, Dave: why, how, and what. So, part of when you're telling me about your background and the company, right? The why always ends up just happening when I ask someone about it. But can we go into detail on some of the other aspects of like those three pieces?
Yeah, excuse me. So if you look at the why, this is a marketplace that's been underserved for a long time. So you've got 65 million Americans that are Medicare eligible, like retirees for all intent and purposes, 65 and older, eligible for Medicare. Demographic wins are at the back of that market as well. There's going to be 75 million folks in that space in the next 7 years. Um, if you look at their what's most important to those folks, it's, do I have enough money to retire the way I want to, and am I properly covered from a healthcare perspective? Because as we know, as we get older, these cars that we live in break down more and more frequently, and we're in the shop, and that costs money. And if you don't have the right insurance, things can go south in a hurry. Um, Original Medicare that was set up to cover this population only covers about 80% of out of pocket costs for folks. So I can make an argument that every single one of those 65 million people should have some kind of commercial Medicare insurance to supplement that which the government gives them. Because one catastrophic event just blows a hole in people's savings. Um, the as I talked about at my previous company, we saw how badly people are treated and the kind of service that they get in this marketplace. Their experience is typically somebody comes to their house, or they get on the telephone with somebody and they're just pounded by a commission driven sales agent that, hey, you've got to buy this plan. I don't know that it's the right thing for you. You, the customer, have no idea if it's the right thing for you. But you're going to get hounded to enroll in something so that that person on the other side can cash a commission check. And what ends up happening with that is that 9 out of 10 people end up in the wrong insurance plan. 7 in 10 people, because that experience is so bad, don't bother to even see if what they're in still fits their current health and economic circumstances. The NPS scores are so negative in this space that people just say, forget about it. Because it's such a horror show. Nobody bothers to figure out if there's a better plan for them. And what we saw was the opportunity to bring technology and data together in a unique and transformative way to help this population in a way that they've never been helped before, and do so that puts people individually in the best plan for them, to do so at scale, and to stick with folks for the rest of their lives so that they never have to worry about Medicare insurance again. It's a huge problem, and we think that we've solved for it in a way that nobody else has with the Health Pilot platform.
So that's part of the also like how Health Pilot wins, right? You kind of had a couple things in there that uh, points to why you guys are doing so well, why you're continuing to grow. Some of that ties into there. Now, in terms of where do you see, like, can you give us a, like, fast forward in your from your point of view, like, where do you see this space heading over the next couple of years?
Yeah, it's a great question. So it's a really fragmented marketplace, and it's fragmented because there are so many of these Medicare brokers out there who are running hard trying to get their hands on as many of these customers as they can. And again, they're doing so in a way that's not data driven. It's not very intelligent. It's definitely not customer centric. It's all about, push somebody into a plan so that I, the agent, can cash a check. And we believe that, as with every other kind of complex marketplace that's out there, technology and data are going to transform the marketplace, and that we're at the forefront of that. So if you look at where we are today, and keep in mind that we built this platform last year, brought it to market, and this is the first year that we're really pouring gasoline on the customer acquisition fire. We believe that over the next 5 years, we are going to go from a very small base of customers today to well over 1 million, with a lot of momentum building, because we are the only company in the marketplace that is bringing artificial intelligence to bear to figure out what is the best plan for each individual customer, creating a broad digital marketplace for folks to go and find that plan through our technology with them. Created I know it's overused, but an Amazon like, just drop dead simple to use engagement platform that people feel very comfortable and confident with. And like I said, stay with them for the rest of their lives, knowing that once we've got their data and stay constant with their data, we can help them through all the changes in their lifestyle and their healthcare situation, changes in the marketplace, and make sure that they stay optimally insured for the rest of their lives. And quite frankly, we see the age of the commission driven sales agent in the Medicare space going the way of the travel agent, and other folks like that have been obviated by a much better technology solution that's customer centric in nature. You're not going to get rid of all those agents, but we think that the way that we've gone about solving for this for customers is ultimately going to transform the way the marketplace runs.
Yeah, that's the thing with innovation, right? It's not that you eliminate every job in a certain space, but you're creating a more efficient process where you don't need that you don't need as many as you did before as a result of it. But you're not trying to eliminate, you're trying to make things more efficient, which as a result sometimes can do that, right? So
Yeah, people are always going to need health insurance, and they're particularly in the Medicare space. It's we're not changing the way that people ultimately, well, we ultimately expect that we will be changing the way people access their health care, and the opportunity for us to engage with people once we've gained their trust and solved the Medicare insurance problem for them. There's a host of additional front door services that we are capable of delivering to those customers that doesn't cost them a dime, that creates significant value in the marketplace, and gets paid for by other stakeholders in the marketplace, whether that's scheduling annual wellness visits, or collecting the data for risk factor adjustments for the insurance carriers to get paid properly by CMS for all of their members, pharmacy refill and maintenance medications to make sure that folks are staying constant with all of their meds. All of these things that are a little daunting for the senior set today, because they just don't know what to do. We're in a position to help them as a trusted partner in terms of how they access healthcare. Ultimately, we think keeping them in a better state of wellness, lowering MLRs for the insurance companies, and just improving the overall process, much as we are in the health insurance marketplace. And we've had a lot. You talk about the wins. We've had a lot of wins of late relative to how we go to market, and we're eschewing the traditional retail spray and pray market dynamics, where you see third rate television advertisements trying to get people to call their broker or what have you. Our go to market strategy is through trusted partner relationships, where seniors have established relationships with large companies already, as in the financial services marketplace, large retail pharmacies, the insurance companies themselves. They all see the unique value that we are bringing in terms of how we engage with these customers and the value that we're bringing to them, and working with them in partnership to help their customers in a win-win-win situation. And the top of the customer funnel is filling rapidly for us because of the unique value proposition that we drive.
Very interesting approach. I like it. And I can tell how excited. This is why I do the video, Dave, because like you can see how someone's eyes light up when they talk about something they're
We
passionate.
are
So
pumped. I cannot begin to tell you how excited we are about what we are doing, how we are doing it, and the changes we're bringing to the marketplace. There's 65 million people out there who need our help. And yeah, we won't be satisfied until we've helped every single one of them and have them as Healthpilot customers for the rest of their lives.
so let's play off of that too, Dave. So clearly you're pumped. Can you tell us what else you're excited about? Maybe what's next for the company moving forward that you're allowed to share, obviously.
Yeah, so like I said, we just built the platform last year, and while we're a year and a half old, we're 60 people strong and growing rapidly. There's so much that we can do with this platform that impacts people's lives relative to some of those additional add-on services that I mentioned. First thing for us though is to build that customer base. So the idea that we can go from a few hundred customers that we managed to get through our pilot program last year to launch the platform, show that it worked, make sure that we were connecting the right way with the United Healthcares and the Humanas and the Aetnas and the Mutual of Omaha's, all of the key partners in the marketplace in all of the 50 states that we operate in. Um, you know, Bringing this to the masses the way that we are now, and then adding on not just insurance, but all of those additional, how do we make healthcare better for you, our customer kind of services? That's a huge focus for us. So we're 60 people now. We're growing rapidly, but the beauty of this business is that you don't need to scale a sales organization of 2,000 people to get to hundreds of thousands and that million plus customer level that we want. It's a traditional e-commerce business, so the opportunity for us to do well by all of our customers, but to build a phenomenal business at the same time is awesome. So we're hiring great people. Everybody's mission driven here. We've got a no assholes rule relative to the team, and I couldn't be prouder of the folks that we got working for us here.
Awesome. Well, I'm super excited for you and for the team, and hopefully we can have you come on again soon. By the way, so we can get an update, hear how things are going, and then talk about some other things as it relates to your business. But I want to thank you once again, Dave, for joining me on the podcast, sharing information about Health Pilot, how you're doing, what you're doing, and then what you're so excited about. So really appreciate it.